Hey everyone, welcome back to my channel. Today I just wanted to share some updates with bottom surgery, as well as talk about how things are going 3 months post-op. As a warning, I may be using some anatomical terms, especially when I'm talking about things like sensation. I might be including some medical diagrams, some pictures I might be editing over. So if any of those are things that might disturb you, it might not be a good idea to continue with this video. But just a quick recap, around the end of last May, I got stage 1 of bottom surgery, and that was an abdominal phalloplasty. Now, stage 1 involved a full metoidioplasty as well as a DIEP flap. The DIEP flap is basically a flap from the abdomen. I'll go into a little more detail about that later. So, how am I doing? How are things working? I think overall, pretty well. I think, I'll start with my upper half of my body and just work my way down so I don't forget things. But in regards to my upper body, nothing much has changed since my last video. I've been able to exercise more, been able to work out just fine. I am trying to lose weight because my surgeon says that I need to lose around 10 pounds prior to stage 2, which is a bit overwhelming because I'm like 110 pounds right now. So if I lose any more weight, I might literally snap in half. And I guess the reasoning behind that is so that the what doesn't end up way too big. Losing weight aside, mobility is great so far, and I'm really thankful for what I currently do have. One thing I have noticed is that when you go a little lower to my abdomen, there's this feeling of pulling or soreness in the muscle. And I've noticed this most when I'm like exercising, lifting weights, running. It's not something that I've ever like traditionally experienced when I do engage in physical activity. So I'm fairly certain that it's related either to the hysterectomy or the DIEP flap. The sensation in that area, it's definitely returning. It's a bit sore to the touch, and I'm able to feel the stitches a little more as well, especially after working out. So now, as for the DIEP flap, this is something that I keep talking about, and that's just because it's really integral to abdominal phalloplasty, or at least the technique that my surgeon is currently using. Let me show a couple diagrams as to what exactly is going on here. So, this is a diagram of our body, and DIEP stands for deep inferior epigastric perforator, but you'll also see this term DIEA, which is just the deep inferior epigastric artery. Now, basically, stage 1, they did a delay flap where they cut one of these two veins. The idea is that the other will get a little bigger and more robust, and then they just harvest that for the graft later. Alright, so I'm going to grab this and bring it up here. And now I'm going to draw a little half box. And this is basically what the scar on my body looks like as of right now. Around the belly button, this area over here, that's where all the soreness is from things like lifting weights, general activity, and whatnot. And then once you get a little lower, there's this pressure-related sensation, but not much else from that. Maybe a little tactile sensation, but on a scale of 1 to 10, it's probably somewhere around a 4. Not a lot of sensation, but it is starting to come back just a little more. Now, I do have to get laser as well, so as of right now, this whole entire area is hairless too, which again is kinda annoying. The scar has healed a bit well, but it's also gotten a little thicker right near the sides, and I assume that's because I'm moving a lot. It's not necessarily keloiding or anything, it's not hypertrophic, it's just extending or, widening a bit. Now there's also just a bit of swelling under the belly button. This is where I can feel some of the soreness, and there's also some swelling around the bottom of the scar. But I assume that the swelling near the bottom of the scar is maybe an indication as to why I don't have sensation there. Obviously that area is still healing, and that takes care of the middle body. Now, I don't have any pictures for the next part. If you do want to see pictures, I don't know, look at my Reddit or something. I do want to talk a bit about how sensation has changed a bit there. One of the things, for instance, that I've noticed a little more lately is that there's been these sort of stabbing pains in that area. When I say stabbing, it sort of reminds me of top surgery, where once the nerves start waking up, they kind of stab at you, And so I've got two hunches as to what that might be. One, it could be related to the urethral stricture, or two, it could just be nerves coming back online. Now, of course, my sensation down there, it's been pretty good. In fact, I think one of the downsides is that it's way too sensitive for its own good. I can't really touch or stimulate things directly because of how sensitive and painful it is. And when I say painful, I mean painful in the sense of overstimulated, right? And so, in a way, I'm hoping that the abdominal phalloplasty will sort of take care of that, especially during the burial aspect. Now, the stricture, that's been something that I've been dealing with for a little while now. It's an unfortunate reality of a common complication after surgery. I'm a bit frustrated. So, long story short, maybe around 3 weeks after I got my catheter out, so probably 6 weeks after surgery, I noticed some thinning of stream, sense of urgency, and so on. I went to see the urologist, had a cystoscopy done. If you don't know, a cystoscopy is basically where they sort of insert a camera in there to look and see what's going on. And in fact, just for the purpose of education, I'll add some photos over here to sort of explain what's going on. So as you can see in this first photo, this is a photo of my urethra, and this is, I want to say, maybe the lower half. It's really what things are supposed to look like, right? It's clear, it's open, there's space for things to travel, to move. And then they went a little further, and this is what they found. And it's just as bad as it seems. All of this white over here, that is scar tissue. This clear bundle, as long as this purple, looks like it's a stitch, but the white itself is just scar tissue. And that has ended up narrowing the urethra. It is a nearly obliterative obstruction. As you can imagine, there's not a lot that can get past this. And so it's been a little difficult to function using, to void. So I was supposed to get a surgery for that, and that was supposed to be an optimum dilation September 12th. Now, I actually ended up having some issues with insurance, and that's been moved over to October 31st. It is quite a while, that is almost 2 months from now, and I'm pretty bummed out, to be honest. I'm hoping I don't have to get a suprapubic catheter inserted, or that it doesn't just close up or anything. I'm going to be 100% honest. I am fully anticipating getting a suprapubic catheter sometime within October. I just don't think, realistically speaking, that it's going to continue to stay open. I don't think that it's not going to close up. I feel like it is getting a little worse, and so I'm just going to assume the worst case scenario there and assume that sometime within the next month I will very likely have to go to the ER for urinary retention and get a catheter inserted. And that's just one of the unfortunate complications that has ended up presenting itself after surgery. Now, other complications that I talked about in my last video were things like UTIs. That can very much be urethral stricture related. Thankfully, ever since going on a course of antibiotics, I haven't had that come back yet. I talked a bit about, bleeding, syncope episodes. I have not been fainting anymore, thankfully. The fainting, that all stopped when the bleeding stopped. I was able to speak to a nurse about the bleeding during one of my pre-surgical appointments, because I thought I was going to have a surgery for the stricture on September. And what she had basically told me was that I ended up with this case of post-surgical anemia, right? Apparently I was just a little anemic after surgery, and that's why I kept fainting. But none of that is happening anymore, so really the urethral stricture is the only complication that I've been having. Alright, moving on to happier news. Because I mentioned that I had some surgical updates, and I'm very excited to talk about that. Obviously the stricture-related surgery was one of them, and that's been moved from September to October. I want to say around the end of October, October 31st is what I'm thinking. But another update that I'm really excited about is my bottom surgery stage 2, because I'm scheduled for December 15th, and I'm really excited. It's going to be the creation phase using the abdominal flap. I am in college, so I had to schedule things just perfectly enough that it would fall right in the winter break, and thankfully that ended up working out. If it didn't, I would have rescheduled to summer or something. But yeah, it's just going to be the creation phase using the abdominal flap. They're not going to do anything else, no testicular implants, no revisions. It's solely creation, so we'll see how that goes. And then update number 2 that I'm very grateful for is that I am finally getting my top surgery revision. I don't know if I talked very much about this on my channel so far. I had a top surgery around 2 years ago, back in 2023, and it didn't really turn out right. It was a peri-operation, and the best way to explain it is that it sort of got me down from B cups to A cups, right? And I still have to get from that A cup to flat. And so I went through this whole ordeal last year, and to be honest, it was just really really rough because I was trying to get this surgery and insurance just kept denying it over and over again for no real reason. I mean, they would say it was medically necessary, but they wouldn't tell me why they thought it wasn't necessary. And it got to a point where, I had that surgery scheduled 4 different times with 2 different providers, and it was canceled all 4 times because insurance kept saying no. So, thankfully I've switched insurances. I've got a new surgery date. It's going to be a second operation at NYU, and the date is March 3rd. So that's around 11 weeks after bottom surgery. And, I'm really hoping it works out. I'm really hoping that nothing goes wrong with the bottom surgery that could end up canceling this peri. Alright, so that's all of the updates that I have as of right now. I want to say thanks again to everyone who's been supporting me throughout this journey, to everyone who's been watching this channel. It really does mean a lot. And ending with a bit of a shameless plug, if you like this sort of content, feel free to like and subscribe so I can keep making it. Take care.